Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServ, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs, and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to the episode 276 of the ASC Podcast with John Goehle, recorded on May 15, 2026 at ASCA 2026 in the National Harbor. I'm Jeffrey Flynn, your guest co-host, the president of the New York State Association of Ambulatory Surgery Centers. As a reminder, the regulatory landscape of ASCs is constantly changing. The content in this episode reflects the most current information available at the time of the recording. We encourage all ASCs to remain vigilant and keep up with any updates or new guidelines released by relevant regulatory authorities. Joining me today is John Goehle, owner of Ambulatory Healthcare Strategies and one of the leading experts in the ambulatory surgery field. With over 3 decades of experience, John has authored more than 10 books in the ASC industry and is a highly respected speaker on topics related to the regulation, accreditation, and financial management. He is also the founder of the New York State Association of Ambulatory Surgery Centers.
And Jeffrey is my dear friend. Thank you so much for joining us. We have a really distinguished group of people, as we often do on our last day of the conference here. We're gonna have to go quickly through this. Jeffrey, introduce himself. We'll start over here.
My name is Tony Lyons. I'm a financial specialist with Ambulatory Healthcare Strategies.
Joe Vinson, and I do resource management with Ambulatory Surgery Centers and Urgent Cares.
And Joe and I have been friends since the organization was called FASA. We were on the board of FASA back in the 90s together, and she's one of my dearest friends in the industry, and I'm so happy to have you with us today.
Thank you. Same here.
I'm Eliza August, the Vice President of the New York State Association of Ambulatory Surgery Centers and the Administrator for Precision Care Surgery Center.
I'm Kelly Frankenfield. I'm a regulatory specialist with Ambulatory Healthcare Strategies.
Christina Norman, Director of Operations for Ambulatory Healthcare Strategies.
Stuart Rosenberg, Life Safety Survey Specialist with AHS.
Kathy Foti, Regulatory Specialist with Ambulatory Healthcare Strategies.
Donna Nofrio. I'm a consultant, retired from corporate life, and a surveyor for AAAHC.
Yeah, I don't believe that, retired for 1 minute. So, point of reference, when we talk about how many books I've written, there are not many people in the ASC space that have written books. Dawn and I usually pop up as the only real writers that have ever been in this space, so great to have you on.
Thank you.
And Alex Yampolsky, Chief Clinical Officer at MedServ.
And I'm so fortunate, our sponsors haven't actually been able to be here. MedServ is one of our sponsors, and thank you so much, Alex, for being with us today. So we talked on the first episode about how excited we are about the conference. Then yesterday we talked about the challenges and how the conference sessions have given us some great tools to be able to improve. My question for the general group here is, was there a particular session that people went to that they really were inspired by or that found interesting?
I will say the sessions where we had the 5 accrediting bodies, it was very nice to have all of them all in one room to be able to answer questions for our members to show up and kind of ask what are they seeing basically in the industry, what's expected. They even had new administrators in the room asking about where could they find the regulations and bylaws they should be abiding by. So I think it's actually a really meaningful session that they should continue doing every year.
And I think they had all 5 of the accrediting bodies there, which is in itself a major project.
I think the courses on infection control, the sessions were fantastic because it keeps changing and it keeps becoming more and more challenged no matter what size the ASC is. So there was a lot of interaction, a lot of good questions, a lot of things like, you aren't really doing that, are you? And but which was a great thing to revisit.
And thank you for mentioning it. I actually attended half of the Lisa Barris's, which was actually a presentation, should have been by Lori Roderick. Lisa stepped in and helped out. And I learned something today, but I forgot they mentioned a tool. Yes, thank you.
I care.
Yeah. And I downloaded it on my cell phone actually, and look, it took a while to download, but it was a tool that I, as a surveyor, thought would be very useful. And just a warning for anybody that's going to be surveyed by me, I suddenly have a tool to be able to evaluate it better. So you're in trouble now. Just wait. I got one coming up in June. You're in trouble.
This isn't meant to be gratuitous, but I just finished a session on strategic planning that I found to be, it was an interactive session with kind of a work group. And for the amount of time especially, it just was very stimulating and really thought-provoking in the development of strategic plan for ASCs and the things you need to think about. And I felt it was very helpful and really a good session.
Yeah, and I was actually surprised at the number of people that were in it. When we put that session together, I really didn't expect, there were 65 people in the room. I didn't expect 65 people to care enough to talk about strategic planning.
And I'm saying gratuitous because John Goehle taught the session.
Your check's in the mail. Okay. Any other sessions? Yes, hang on.
I really enjoyed my session on litigation this morning. I think as a former paralegal, the importance of your documentation and how that can either make or break your center when it comes to those types of situations. So I think it's important, especially if you're still paper intensive, that you're really being cognizant of how you are documenting those things and maybe pulling some. Auditing those charts really closely to make sure that they are being documented correctly.
Well, and one thing that comes up whenever they have a session like that too is I remember a while ago when you ask a lawyer whether they want to see a paper record or an electronic record. Anybody know what the general answer is? It's paper. It's paper because of all those drop downs, all those defaults that inevitably get you into trouble. I do a lot of expert witness stuff, and that is inevitably the problem. That if I'm defending them, I'm troubled. If I'm on the other side, which is rare, I've got a lot of information that's going to be out there. Any other sessions? Yes.
Yeah, I just want to say that the sessions that I attended, they've all been with great speakers. Everybody's so engaging, and there isn't one particular that stands out, but it's just awesome to see how engaging speakers are at ASCA and how engaging the crowd is. Yeah. And it's always good discussion afterwards.
I've had a ball here. I've done 2 sessions here, and I've been, it's kind of, you're always a little bit nervous, even though you're as experienced as I am doing it. But every time I got up there, it was the audience. It was the people that were out there that were so excited, that were interested in learning. And for those of you that are aspiring speakers, please don't be that monotone voice out there, giving the information. Ask your audience. We asked a couple times, is this what you expected? Because I was willing to drop the slides. And as a matter of fact, we kind of did that with the first session because the slides were not ours, and we just moved on. So be ready. This is a tough job to do speaking. I'm looking at you, Dawn. You haven't spoken yet, and Dawn is on the podium an awful lot. So I'm going to pivot a little bit, Dawn. You and I, and Joe have been coming to conferences longer than some people in the room have probably been alive. And so, Dawn, what do you have to say about ASCA here? It's great to have you back here. I know You've been here frequently. You're not here every year, but what are you taking away from this year that perhaps you didn't expect or you haven't seen before?
I don't know if there's anything I haven't seen before. I have a collection of magnets that are probably 20 years worth of ASCA
from
magnets.
From each of the conferences?
From all the conferences, yes. So I had to collect my magnet. The networking is just awesome to be able to see people that you've maybe not seen for a long time, or you don't know when you're going to see them next. Yeah. So the networking is awesome. I do want to say I truly enjoyed the session that Joy Himmel did on stress and burnout and taking care of ourselves.
Can you talk a little bit more about that? That's a good one.
Yes, I appreciate that ASCA took the time to do that, to have that session, because it caused us to think and she gave us some tools and to recognize when we're having stress and how to cope with it so that we don't get into burnout and get into a bad place, and just general everyday things like gratitude, being grateful for the things that are happening in your everyday life. So it was nice to have a session like that.
Yeah, and I think that one of the challenges that we talked a lot, all the sessions we talked about, we've had challenges with regard to our staffing and leadership. I'm very concerned about leadership as we move forward, especially since there's a number of us in the room that are probably the more seasoned, right? Leaders in the industry, and it's time to start moving on, and preparing the next generation for it is an important goal and an important part of our legacy here. So thank you for that. Any other sessions before I move on to another question? Any other sessions? I want to actually pick up on your whole conversation, Dawn, about the networking here, because I'm going to admit, I'm going to get in all kinds of trouble. I've really only been able to attend a couple sessions here because, I walk out into the hallway, I meet 17 people that I haven't seen in a year. So the NAPGARY Award this year went to Kate Tucker, one of our dear friends. The three of us, worked with her over the years. She was an incredible resource. She has one of my puppies. Actually, her daughter has one of my puppies, so I am always checking in on her to find out, how she's doing. But I couldn't imagine anyone more deserving than that. It was just great to see her again. So I'm going to look at you again, Joe, because you and I have been together for a very, very long time. We were on the board, as we said, together. So you and I have been attending these sessions for a long time, and we have war stories, which we're not going to repeat here. Okay. But were there any interactions that you had with people here that particularly stuck out, that either, encourages you for the future or makes you wonder whether we need to pour some resources into something?
Well, I think the interactions, I hate to use the word networking all the time, but I think it's just seeing people in different roles and how everybody has, they're more ready to share with you. No matter if you haven't seen them for a year or 3 years, you say, oh, okay, and you get new telephone numbers for the same face. Yeah. And it's a good thing to be able to share experiences and what you're doing now. And then there was a couple, I sit down for breakfast this morning with a couple of, but very young people. And, sort of was talking. I said, are you a surveyor? I said, yes. I said, can we ask you a question? We're getting ready for our survey. And I'm like, okay, a question, sure. I didn't say it like that. And it was amazing because immediately they just had no one to ask. And they said they came here looking for people to talk with. And they thought it was so great that people talked with them. Mm-hmm. And that made them want to come back, just because people talked with them, not at them.
Right.
And I thought that was fantastic.
That interaction is the key to the success of this. I'm upset that I wasn't able to get to any sessions, but that doesn't mean I didn't take something away from it. Jeffrey, I'm looking at you for a sec. Oh, go for it.
To pick up on that, the interaction, too, is we all live the same world, and it's a rare world. So if you can't find someone to connect with within 5 minutes, there's something wrong with you, to be honest with you. But the whole issue is with the networking, but also be able to sit there and say, you know what, I wanted to call you and ask you a question and reconnect that, and let me call you Monday or let me call you Thursday to reconnect that is so important to get everyone together in that same field. But the energy of we all are in the same boat in this unique industry where most people don't know exactly what we do in the general public, as we further try to educate people to understand that surgery centers are where you do want to have your procedures done compared to the hospital setting where there's sick people, infection, and everything else. We do have that great story to tell, but it's always heartening to come together and really get together with everyone in the same setting and go forward.
Kay said something in her acceptance speech where she was talking about how over the years her role has been in developing copy, basically, assisting and putting together articles to convince the rest of the world that doing surgery in an ambulatory surgery center was a good place. And she mentioned something that sounds like a joke but was not. One of her missions in the early years, and we've been around these early, I'm sorry, I wish that we had a camera here, but some of us have been around a long time. And we remember going on Capitol Hill and talking to a congressman, and they say, so ambulatory surgery, so you do surgery in the back of an ambulance? I mean, it sounds crazy. Kay said it on the stage, but it's not a one-time thing. That's happened, many times.
How many ambulances do you have? It's still a question asked today.
Yes. Yeah, it really does show, how the people that make a lot of the decisions about healthcare both at the state and the federal level, are really out of touch with what actually happens in the trenches. And to that point, the importance of making sure we invite people to our center, whether you're doing it formally through the state associations or through the National Association. I'm going to look to Jeffrey and Eliza here for a second because you're our representatives. I mean, I'm on the board too, but I just wanted you to talk a little bit about how important it is to be active in the state association as well as the national. I'm going to look at Eliza for a second, put her on the spot, and then I'll let you repeat.
I say it's very important because we're very powerful together as opposed to basically being one singular person. I actually sat on a panel about state associations at this conference, and a gentleman brought up the fact that he had an issue with a law in his state. He went to go speak to his senator, and the senator was just like, well, I don't know what to tell you. Then when he went back and spoke with his state association, they were able to actually get legislation passed by actually coming together. I would say that even in New York, we've been very successful with basically, kind of killing bills that were trying to get rid of facility fees for us. We were able to get cardiac into the state. It really just shows the importance of how working together will really get you farther. And on top of that, was really great about the networking piece of it to tie it in. I actually met other people from other state associations who are struggling, who are now looking to us to kind of help them build up their state association to get to a point where they can all collaborate and be as successful as we've been.
I think the key point is the state association is your community. And that's the one, if something's wrong, you can call somebody. How many times have I called you, John, through the years? I mean,
it's actually kind of annoying, but.
I was afraid you're going to lose my number.
Or block.
But it's one of those things to be able to say in geographic areas where we're together, I ran out of this. Do you have it? I can't believe we did. Our order didn't come in for this. Can you help it? And it's through the associations that we're building these communities in the different regions. And then obviously on the national level, also participating in the sense of the national level. But the state level, it starts with getting to know your neighbors and really then starting to, how can we work together as a community?
Yeah, I do think it's important for you to be active both at the federal level and the state level as much as you can afford to do that. Christine, I'm going to go to you for a second. Christine is our Director of Operations for AHS. She did a fantastic job, by the way, with our booth this year. Thank you for this. I don't want to talk about advertising for the booth, but let's talk about some of the interactions you've had, because there's been a lot of people that have come up to the booth. And from that, and we talked a little bit yesterday about some of the things that you've been hearing, but what were some of the key takeaways and things that we as an association, as well as we as individuals, have to be focusing on over the next year to help those people that brought up some issues?
I think that you already said it. The word help. I think a lot of people are scared to ask for help because they almost see it as it makes them look inferior to people like their owners, their governing board, even their own staff. But in my mind, if you're the leader of your surgery center and you're the one that asked for help, I see you as more of a stronger leader than anything else. And I wish people knew that more. And, when I see people coming up to our booth at ASCA and they look so overwhelmed and so burnt out, and it's like, if you would have just asked for help just a little bit ago, you wouldn't be the way that you are right now.
Yeah. And the help is always there. I mean, I think I've been in the industry 37 years. I get it. But one thing I found very early is when I was the newbie, when I was coming into the association, meeting people like Joe and Dawn, they reached out. I mean, I didn't know either of them. They were great nurses. They were great mentors to me. And there were many others that some of them have passed on in those days. Knapp Gary, for example, who unfortunately died way too early. Those are the people that I remember. Those are the people that made an impact on us. And those are the people whose footsteps we're following in. And our job now that we're a little bit older is to make sure we pass it on, because that legacy, that stuff that we learned, that we passed on, needs to be passed on to the next generation also. Stuart, I'm going to look at you. Both you and I were in part of the life safety presentation. I got to say, it's the first time I've attended a life safety presentation where they actually stuck to the time frame. I mean, it was just good control over it, but let's face it, life safety is our nightmare scenario, and I thought he did a great job. Can you talk a little bit about some of the takeaways? You know as much as he did, but I'm sure there were some takeaways that you took out of that I thought was particularly interesting for the audience.
Well, the first thing I want to say is that Destin Phillips is a phenomenal speaker and a phenomenal individual. He's a AAAHC surveyor as well as a consultant, as well as has a real job. I think one of the things that he did was, I think pretty early in the presentation, unintentionally, he pointed out observation. He asked about exits in the room. And what he was pointing out was that the exit in the front of the room was completely obscured. Nobody knew that that exit existed. And I think from a life safety perspective, that's one of the things that I walk in and I'll go, And the folks that are running the ASCs miss those things all the time. I caution people not to become eye blind and nose blind in their own facilities. He did a great mini presentation on life safety and electrical systems. I think, John, you talked about him staying in the time frame, but what was interesting, he answered all the questions, and then there were 20 people after the end of the session that wanted to ask more questions.
That didn't feel the questions were relevant to the entire audience or very
Well, I
specific.
just think he ran out of time. There was that much. And what I would say is the need for life safety at ASC-related meetings is so important because we know that life safety isn't in the administrator's wheelhouse or the DON's wheelhouse. And DONs and administrators are being asked to do more and more, and they just don't have the bandwidth to pick that up. So on the podcast, John's drop-in sessions are a great way to get some of your questions answered.
And those are for people that are a member of our Patron Program that we talk about. Thank you. Thank you, Stuart. Okay, Kathy, I'm going to talk about quality. Kathy is my quality guru. We stole her away from, we didn't steal her. She came to us when she had to move. But she was a full-time quality improvement nurse. That was her full-time job, a relatively large organization. And she's the one we look to when we want to be, talk to somebody that's really lived it in the surgery center, like day in, day out. I know you've attended a lot of different sessions, not all on quality, but what are some of your takeaways, not only from the sessions you attended, but some of the interactions with other people?
Pertaining to quality, I get this a lot, and I always say whenever I'm having meetings with people or visiting with people, and they're saying, well, I'm having a problem with this, or I'm having a problem with that, or even in the session, strategic planning. When you plan something and you set your goals, your measured goals, you've now created a quality improvement study. Could be for the year, could be for 2 years. I think anything that you set your mind to that you want to change or improve upon, you've got to study. And I'm constantly, hey, that's a good study. We could do this for a study. So
yeah, we talked about in a couple of our sessions how everything ultimately leads to quality improvement. I look to you to this, but we're talking about materials management. One of the suggestions I made during materials management, if you haven't put your materials manager on your quality improvement meeting, you're missing a huge opportunity to tie cost, quality, and other measures into it. We talked about how when something goes wrong, and it involved not having a particular supply, you better have that person there in the meeting. I don't want to blame him because it's probably not his fault or her fault. You want to have that conversation as to what caused that. So we have a pharmacist here and a dear friend of mine and, of course, one of our sponsors here. Talk a little bit about some of the takeaways from pharmacy. I actually haven't talked to anybody about it.
The pharmacy session hasn't happened yet. There's a session tomorrow
that
Michael O'Neill's doing. He's a pharmacy consultant in Tennessee market. So really looking forward to that. He's going to, I think, cover a lot of topics on compliance and safety. And the one thing that I see through my job with MedServ and working with a lot of ASCs around the country is that we put nurses in the position of running pharmacies without a pharmacy department and without a team of pharmacists and an army of pharmacy technicians, and we expect them to succeed with very little training. And then we're surprised when we're over ordering or we have outages or we have things that may happen. So it's great to see great pharmacists out there helping centers.
Yeah, and one topic we've talked about a lot is not every state requires you to have a pharmacy consultant. I dread going into a center in a state that doesn't have a pharmacy consultant because, first of all, if I'm the consultant working with them, it's a lot more work for me because and things that I just don't understand. I have to call you. But the point being is that a good pharmacy consultant is somebody that you're consulting with on an ongoing basis that is helping you through some of those tough questions, looking at your medical records, looking at your policies, and helping you to make sure that you're fully compliant all the time.
Yeah, absolutely. And Unfortunately, there aren't too many pharmacists like that around the country, and it's kind of hard to find.
Yeah.
But as you poke around your community, talk to your association members, talk to your ASCA friends, and find out who they're using or what they're doing. Because some pharmacists could do a good job. They just don't know what to do. They just come in and count your narcotics once a quarter, and that's not really valuable.
Yeah, and being very careful to make sure that your retail pharmacists have a great job. They do great work, but they're not necessarily the right people for this type of job. Go ahead, hang on.
Yeah, and I think with the pharmacy component and the accreditation surveys, people don't really, the way it's written, some of the standards, JCOs and HHCs, says, you have to have a physician or something over the pharmacy or person. And I just worked with someone last week that had 8 ORs, huge busy place, and they didn't think they had a pharmacy consultant because his anesthesiologist has been more doing it, he thought. But then I started reading contracts, and there was actually a contract with this third-party vendor that somewhere was signed over the last 10 years. It's evergreen, they're paying for it, that says, it doesn't say what he or she's going to do, but they do compounding for the center, which they still get these drugs in. They admitted to that. They had no clue what batch testing was that they should have on site from the compounding. We went through that. I showed them the federal regulations for a compounding pharmacy that was put in after the New Jersey crisis. So I became more or less, instead of just watching to see what they were doing, I became 2 days of teaching with this type of thing. And I said, so it says here annually they do a consulting on site. What paperwork do they give you? What do they actually look for? Do they look for DA if you have a diversion? I mean, there was nothing that said what they did except consulting. So I think that's a big miss, because even if people go out and sign a consulting agreement with a pharmacist to come in quarterly, they don't have the elements that person's going to do and what documentation should be done. And should they just come in and ask questions and they say, yeah, they're doing that, and they leave. So I think ASCs they try to be compliant with things, even if it says your state you're supposed to have a pharmacist, or someone else. New Jersey used to say a nutritionist. It was like, really? Or a social service.
New York social worker,
yeah. So, but no one said what these people were supposed to do.
Right.
And I think that's the bigger miss than just not having someone.
Anybody have any last minute thoughts? We have the party coming very soon, so, I can see the itching coming.
Keep it quick.
Yeah,
Keep
no
it quick, but I think having Samba here was also a real plus.
Can you describe what happened? Because I don't think we haven't talked about it yet. What's different about this?
That ASCA and the Ambulatory Anesthesia Association is also here with ASCA.
Right.
So
called Samba.
Yes, called Samba. So having them here, there are people attending that you get to interact with that aren't always here for ASCA meetings. So I went to one of the presentations, yes, and it was just awesome. And they are very complimentary about the ASCA conference and how great an experience it's been for them. And I think it's just been fun having them here because it's a whole additional piece that we don't normally have here and that we benefit from.
Yeah, and I've developed some relationships because I have a lot of anesthesia relationships. We are hoping to put together an anesthesia conference, a micro conference, one of those full 8-hour conferences later this year, because it's about time we really talk and talk deeply about what's going on. Any other last minute thoughts? Yes.
My thoughts and comment really is on ASCA in general. Every time I come, it's just it's so great to see how much of a community everybody here is. Everybody here is eager to learn, eager to improve, and it's great because they take it home. And then hopefully the message spreads to their neighboring centers, and hopefully the community grows, hopefully everybody improves. But it really feels almost like a family event here. It's really great.
That is so true. This is really a family, here. I mean, people, I've been coming for 37 years, and sometimes I only see people once a year, like Dawn and Joe I talk to during the year, but Dawn I think I only see once a year. It's great. And a lot of I see you guys all the time. But, and my employees, see more than I want to. But I didn't mean that. So on behalf of the ASC Podcast with John Goehle, on behalf of all of our brands, Ambulatory Healthcare Strategies and the ASC-Central website, we want to thank the Ambulatory Surgery Center Association for their hospitality here and helping us to be able to present some incredible discussions here. Please, if you didn't catch episode 1 and episode 2 about this, definitely catch that over the last couple days. And with that, we're signing off for another year at ASCA 2026.
Every ASC professional knows that running a surgery center takes knowledge, skill, and a strong support network. That's why we created ASC-Central.com, a place where ASC leaders and staff can learn, connect, and grow together. ASC-Central is a comprehensive hub for education and professional development in the ambulatory surgery industry. Our leadership bootcamps, on-demand conferences, and membership programs are designed to meet the needs of administrators, nursing leaders, medical directors, business office managers, and anyone committed to excellence in outpatient surgery. Our leadership bootcamps are guided, mentored programs that help develop the next generation of ASC leaders. Whether you're new to your role or looking to refine your skills, these bootcamps provide the structure and insight you need, and many of them offer AEU credits for CASC certified administrators and IPCH credits for CAIP certified professionals, supporting your ongoing professional certification. ASC Central's on-demand educational library gives you access to in-depth programs on compliance, quality improvement, infection control, credentialing, finance, and more. These full-length virtual conferences are designed to be both informative and engaging, not just check-the-box webinars. Many also include CASC and CAIP continuing education credits. For those who want ongoing learning and connection, ASC Central offers flexible membership programs. The Patron membership gives you access to Zoom discussions, key conferences, and a robust resource library. The Premium Access membership adds full access to all boot camps, private consultations, staff training, exclusive content, and ongoing support from top experts in the ASC field. If you want to be part of a community dedicated to raising the bar in ambulatory surgery, visit asc-central.com or email us at info@ascpodcast.com. ASC Central, bringing ASC professionals together to learn, grow, and thrive.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServ, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.